More Lubbock children between the ages of 6 and 17 tried to commit suicide than anywhere else in Texas. That's according to a new analysis from the company National Healthcare.
KCBD News Channel 11's Sydney Lowther is digging into the report to find out what is leading our city's children down such a dark path.
I want to disappear, or I wish things would go away, or I just want to run away, or the pain needs to stop.
That is the kind of downward spiral children face here in our backyard. A national healthcare study ranks Lubbock #1 in suicide attempts among children ages 6 to 17.
It starts with us, and it starts with a conversation.
Dr. Cameron Brown, a family counselor, ties this phenomenon to another problem Lubbock faces: child abuse. On average, each day, 3 children suffer abuse or neglect in our city.
These are things that are occurring at home. These are things that are occurring in other systems that they're a part of. And that's a troubling statistic.
Dr. Sarah Wakefield is the chair of psychiatry at Texas Tech Health Sciences Center. She says children are more impulsive because the decision-making part of their brain has not fully developed.
Have a suicidal thought and act on that thought more quickly than someone who has more impulse control and is older.
To identify suicidal thoughts in a child, Dr. Brown recommends looking out for the 3 C's. First, connection.
Are they looking to be alone more? What are their friends' situation looking like? Do they have friends? Do they feel connected at school? Do they feel like they are supported?
The second is conflict.
Bullying, I'm talking about discrimination, I'm talking about abuse at home, I'm talking about abuse in the school settings.
And third, contagion.
Suicide is highly contagious. And so when somebody dies by suicide, there is a significantly higher rate that they're also going to be struggling or wrestling with suicidal thoughts.
Dr. Wakefield says it is important to make sure your loved ones feel heard. She says sometimes it's a simple question of, how was your day?
We can make it okay to say, and we can start these conversations well before someone is feeling so isolated and hopeless and helpless.
If you or someone you know is struggling with thoughts of suicide, there is help available. You can call the National Suicide and Crisis Hotline at 988 anytime, day or night. Sydney Lowther, KCBD News Channel 11.